Hi, my name is Shephard. Today I will be demonstrating how to perform a lat pull down. The latissimus pull down is a back strengthening exercise. There are many variations of this exercise. These variations include pronated narrow grip, pronated wide grip, wide neutral grip, narrow neutral grip, and the reverse supinated grip. With that, the variation I will be demonstrating today is the pronated wide grip, and the muscles that are utilized in this exercise are the latissimus dorsi, teres major, posterior deltoid trapezius, levator scapae, bicep brachii, brachialis, brachioradialis, tricep brachii, rotator cuff, and the rhomboids. The agonist muscles in this exercise are the latissimus dorsi and the teres major. The synergist muscles are the rhomboids, posterior delt, levator scapae, the bicep brachii, brachioradialis, brachialis, and the trapezius. The stabilizing muscles of this are the tricep brachii and the rotator cuff. In the clip that I'm just about to show, I'm going to display the proper technique, tempo, and breathing regimen of the lat pull down.
Before beginning your exercise, make sure the knee pads are set to where you feel a secure but comfortable position. Feet remain flat on the floor with hip width apart. Knees and hip must be 90 degrees. When gripping the bar, you must have shoulder width grip. Before going into the phases, brace your abs and draw them in. Lean your torso back 20 to 30 degrees and keep your spine neutral. We begin this exercise with the concentric phase, pulling the bar towards the body. Shoulders should be adducted, and shoulders should also be horizontally abducted with elbow flexion, scapulae downward rotation, and retraction. When returning the bar, that is the eccentric phase, where shoulders should be abducted and horizontally adducted, elbow extension, and the scapulae should have upward rotation and protraction. The breathing tempo should be exhaling on the concentric phase and inhaling during eccentric phase.
If the latissimus pull down is too hard for the athlete to perform, then a regressive exercise would be kneeling resistant tube pull downs. If not, if it's very easy and they're able to perform it and are on the last phase of the strengthening exercise, then we can do a progressive exercise, which would be a pull-up instead. Some common errors with the lat pull down is that athletes will want to bring the bar behind their neck, which is actually shortening the range of motion of your latissimus dorsi muscles, which is why we want to avoid that at all costs. Also, sometimes they use too much weight, so they'll have to use their body momentum to pull the weight, which ends up not doing proper technique skills, and you're not activating the correct muscles. If you also have too wide of a grip, in that as well will be shortening your range of motion of your muscles. Two coaching cues that I want to give to someone when performing this is that you want to sit up but slightly lean back so the bar comes to the center of your collarbone to the chest. Also, you want to have a steady fluid motion because this helps avoid injuries, and it activates the correct primary muscles of this exercise. Proper technique for spotters when watching someone do the latissimus dorsi pull downs is basically just stand behind them. Don't get too close to them because they are going to be leaning back. All you're going to be doing is having your hands on top of the bar, and you're not putting any pressure on this bar. However, if they're having difficulties pushing it down, then you'll be able to have your hands there and just slightly push down as they continue throughout the exercise.